Many women want to know what causes incontinence. Daily habits such as what you eat or drink, certain medications or supplements that you may take. If you're reduced physical mobility, so let's just say that I have a lady and I'm saying, so how do we need to control your bladder? And she says, well, I use my walker. Well, right there, I know that she has difficulty getting to the bathroom. So her incontinence is usually related more to her physical mobility. So we see how we can address that, maybe put a bedside commode or something else that can be done. So that's just a minor intervention without her having to have a surgical intervention. Pregnancy, childbirth, radiation, or any kind of pelvic floor injury. For instance, when you're having a baby, if you had to have any tears during delivery time, or just interruption of those nerves can cause incontinence. So there are 3 common bladder control problems. One would be stress incontinence, and we'll go over what that actually means. One is urinary retention, which means you're not emptying your bladder. And another one is just what it says, overactive bladder. You're having to go to the bathroom too often. So first, stress incontinence. That occurs when you have some leakage of bladder, whether it's your urine that's in large amounts, small amounts, it doesn't matter. If it's causing you a compromise, then that's not normal. That's when you sneeze, cough, or laugh. Or when you're at the gym and you're exercising, or you're outside and you're lifting something, or you're lifting furniture, exercise, bend, or lift, and you lose urine, all that's not normal. When you climb stairs or stand up, or when all the time to avoid going to having an accident, you're going to the bathroom just to avoid having an accident. So I know I have so many women that come in and I said, do you have any problems with the loss of urine when you don't want to? And they said, oh no, honey, I just don't drink all day long. Well, that's not what we want to do, because then you're causing compromise to your kidneys. So any little thing that can trigger a leak drives this lady crazy, and it should be driving you crazy as well. So urinary retention. If you can't tell when your bladder is full, or if you're unable to fully empty your bladder, or when you're actually going to the bathroom, you notice that your stream is not normal, you're starting to dribble, or it's just a weak stream, or actually you're having to use a catheter to empty your bladder. So many women have retention so much that they go to the bathroom, they empty their bladder somewhat, and they have to finish doing that with a catheter. So it can be incredibly frustrating to have something so simple cause this big of a problem, but it really does. So overactive bladder, you've seen these little signs before, all of a sudden you are sitting there talking with somebody and then you have to squat or bend or put your knees together so that you don't leak. This happens before you reach the bathroom. You have frequent leaks after drinking a small amount of liquid. When hearing or touching running water, you feel like you're going to leak urine. You have to use certain kind of pads or protective garments so that you don't mess your clothing up if you're at work. Frequent, uncontrollable urge to go, that gotta go that you see on the commercials. That really needs to be addressed. I know there's the commercial that always makes me laugh where it says, pads aren't just for football players anymore. Pads are for you. Well, that's not true. Pads are for football players, not for you. So you come see us and we'll make sure you get rid of those pads, or at least decrease those pads. So if you feel like you're going to the bathroom more than 8 times a day, or if you're having to get up frequently throughout the night, or you're feeling like your bladder is never empty, or you think, I never drink anything during meetings because I'm afraid I might leak. I mean, gosh, that your bladder cannot have that much control over you. Let us control your bladder. Same with fecal incontinence. If you feel like you have the inability to resist the urge to go and you're having embarrassing accidents, or you don't feel when you go, all of that needs to be addressed and we can help take care of that. This patient says, I'm having accidents to the point that it limits what I can do and how I live my life. Just don't let it limit you like that. You do not have to put up with those limits any longer. So the good news is there's plenty of treatments, and the majority of these treatments are minimally invasive. So there's minimal to no downtime. The hospitalization is like a little drive-through. You come in, do your procedure, and go home if we have to get you to the hospital. So let's look at this. How do we treat overactive bladder and fecal incontinence and get back to living your life? So first of all, the conversation has to start, right? So if your physician doesn't ask you, or if you feel like any of these things are going on and you're too embarrassed to discuss them with your physician, then just come in and see us and we'll get you on the right care plan to take care of your issues. After we talk, there can be certain things that can be a dietary modification or certain lifestyle changes that you have, like if you work or if you have it where you can't go to the bathroom at least every couple of hours to help empty your bladder, we can talk about some of those things. And some of those minor changes can fix your issue. If that doesn't work, then there's certain medications on the market that really work well without causing you too many side effects. If we've exhausted going through these first couple of issues, like changing your lifestyle, changing some of your diet, and offering medications, then that's what we get to what we call our advanced therapies. So here are some of the simple solutions that we talked about earlier. So I'm not going to go into these much further, but you can see it could be your diet, it could be your exercise, it could be that you just have to do some physical therapy to retrain those muscles in your pelvic floor, how to hold your bladder better. Some of the oral medications that work really well cause people too many unpleasant side effects that they don't like dry mouth, blurry vision, constipation, or high blood pressure. And actually, when we looked at a recent study, it showed that 72% of people stopped their bladder medication within 6-month period because they were having these. And get this, they thought that that was all they could do was take medication. So they didn't even go back to their doctor for anything further. They're just having to deal with pads and deal with their current issue because they too think it's a sign of aging. So this is where we'll talk about some of those advanced therapies. So if physical therapy, changing your diet, changing some of the things that you do as far as your everyday living, if those type of things don't help and if the medications don't help, then this is where the advanced therapies come in. So as Kyle told you earlier, he is part of the Medtronic InterStim system, which also has a Medtronic neuro system and then also with some injected medications. That's with Botox. That's not necessarily with Kyle, but that's a great thing that we do and gives a lot of people great results without having to have a little procedure. Bowel control, Medtronics also helps with bowel control. So if we're talking about Botox, Botox is the same medication that we do to help relax muscles of the face, facial expressions, to decrease fine lines and wrinkles, except for it's a medical component Botox. And once we have you and make sure that you don't have any type of infection and we do other type of testing on your bladder, then you would be, and you don't have any of the contraindications to Botox, then you would be a candidate for Botox. And with Botox, it's a little outpatient procedure. It's truly a drive-through procedure that we do in the hospital. We bring you back in 2 weeks for a follow-up. And if everything has worked well with you, in 6 months, we repeat the same procedure. And you can do that. It works very well for a lot of patients. But don't get frustrated, because if Botox doesn't work, then that just means that the muscle of your bladder is not the issue. It's the nerve that's the issue. So that's when we move into more therapies like Kyle offers through Medtronics with the InterStim. So this is the InterStim. This is actually the peripheral tibial nerve neuromodulator, which is a little test that we can do in the office that lets you know and helps restore bladder function. It gently stimulates this tibial nerve right here in your shin. And it's a little treatment that you would come and do for 30 minutes. It's an in-office session for 12 weeks. And then it's followed by your maintenance therapy that you do monthly. And it gives a lot of patients long-term relief. It's given them really great quality of life without them having to constantly worry about their bladder. A more common system is the InterStim system. And I like to think of this as like a little pacemaker for the bladder. So it actually helps stimulate and control the nerve that controls your bladder to get things under control. And you don't have to do anything. It's a one-time procedure. There's a test to see if it's going to help you that we do in the office. And if it does help you, then we take you to the hospital and we put the little nerve stimulator right next to the nerve that controls the bladder. And then there's a little implantable device. And the size of these, the smallest one is about like the stick of gum, and the larger one is about the size of an Oreo. So that kind of gives you how small the device is itself. So as I said, it's a general nerve stimulation that corrects the communication that we talked about earlier between your brain and your bladder or your bowel to help restore proper function. So we do a little test in the office, as we talked about, and then you and I can decide how we're going to move forward with this. Once we decide that we're going to move forward, then it's a little procedure done in the hospital. You'll probably be in the hospital for a little less than 2 hours from the time that you get there, get checked in. We take you down and do the little procedure itself. Kyle or one of the reps from Medtronic come in and show you how to control the little stimulator itself. and then you're free to go home. I see you back in the office in 2 weeks. If you've had the whole procedure done, then that's all you have to do. I'll do a periodic follow-up to help you adjust your stimulator if you can't do it on your own. It comes with a recharge-free system. So some people don't want to have anything else to do with it. They just want to make sure it's recharge-free. Other people said, no, I'll take the rechargeable device. It just really depends on how you want to do it. And you and I will discuss that in the office. So let's say you say yes to the test. So we've tried modifications of the diet. We've tried everything else. We've tried the medications. Maybe we've even tried you on Botox. So this is the next little step that we do. So we do this actually in the office. It's a little lead or a little wire, a thin wire that's inserted right in the upper buttocks part that goes right next to the nerve that controls your bladder. It's attached to a little small external device that's actually worn underneath your clothes, so nobody even knows that anything has been done. You go about your regular activities for about 3 to 14 days, and we see how well you're doing. If you feel like you've had at least a 50% improvement, then we feel good to move you to the next InterStim to do the permanent stimulator. If you don't really feel like it's improved that much, sometimes the little stimulator itself can move, and so we just take you to the hospital and do a little staged procedure, because we don't give up on you just yet, because this procedure gives ladies lots of control of their bladder. So this is actually 89% of people using the Medtronic bowel control experience good success from fecal incontinence, and 76% of those women, that's 76 out of 100, get great improvement with the sacral neuromodulation, compared to just 49%. That's not even 50% of people that get improvement with medications. So how would we know if this therapy is right for you, if you'd be a good candidate or not? So if you feel like you have significant symptoms of overactive bladder, or if you feel like you're that person that has that urinary retention, like you have that dribbling, you just don't feel a good stream, or you feel like you're not emptying your bladder well, or you're even having problems with fecal incontinence, which is soiling of your clothes when you don't want to have that fecal incontinence. If you've tried lifestyle changes and medications, and these treatments haven't worked for you, or if you've tried Botox and that hasn't worked for you, that's how we know that this Medtronic system, this little InterStim stimulator, is the next option that we can try. So here's a few common questions that I have about the Medtronic InterStim system. How long does the relief last? Well, the sacral neuromodulator has been shown to be effective for at least 5 years, and later studies show it's effective for even longer than that. Will it cure your condition? It can provide significant effective relief, but it's not a cure. But what it does is it gets patients back to their normal lifestyle. So they feel like it's a cure, but it's actually something that we'll just have to continue, because the batteries have a certain life. Some of them are up to 12 years. So you just may have to have a battery change out. But like I talked about, that's just a very small procedure that's done in the hospital. It's just kind of like an in and out same day. What does the stimulation feel like? Some people say it feels like a little tapping. Some people say it feels like butterflies or fluttering. Some people say it feels like tingling or a pulling sensation. If you feel anything different, then you just come in and we look to make sure that the system is actually working for you. Another common question is, will my insurance cover the cost? The majority of private insurance companies, as well as Medicare, will cover this system. And we check all of that for you on the forefront before we even do the procedure. So the new latest greatest thing is, can I have an MRI? So in the past, this has been an issue that we've had people as they age needing to have MRIs, and the previous stimulators were not MRI compatible. But the greatest thing is now they are. You can have a full body MRI scan under certain specific conditions, but we'll tell you about all those things. There's minimal risk related to the surgeries because it's a small little implant site. There's a little thin wire that may cause a little bit of pain and discomfort right at first, but the majority of people have minimal to no complications with this procedure. So how do you find a specialist? Well, you don't have to look any further. We at Acadia Women's Health, myself and Dr. Gonzalez, do these procedures. We take care of urinary incontinence on a daily basis. We're actually one of the largest number placement of InterStim in Southwest Louisiana. So you can pull us up and look, and Kyle can attest to that. if you need more information about bladder control, you can feel free to call us at our office, 337-785-2006. If this is something that you feel like is really bothering you and you haven't tried any of the other things, we'd love to see you in our office. Go ahead and email us tonight. You can email us at info@acadiawomenshealth.com, and one of our specialists will be back in touch with you tomorrow to get you in for an appointment. So I think there's a few other questions that we have, and I'm going to open the floor now for more questions, and I'm going to have my marketer or Kyle assist me in answering these questions. Do you treat interstitial cystitis?
Go ahead, Dr. Owens.
So I'm sorry, Kyle, did you not want me to do that? Or that's okay?
No, that's perfect. I was going to say there's a few questions coming in through the Q&A. If you'd like to address those, go right ahead.
Okay. Yes, we do treat interstitial cystitis. And although, and Kyle's not listening to this, although the InterStim is not on label to treat interstitial cystitis, I have a lot of patients that use the InterStim for their urge incontinence or overactive bladder that get a significant improvement with their interstitial cystitis. So the reason that I say that there's other options to treat interstitial cystitis, but the InterStim does work, it will just be a whole issue as to whether your insurance will cover it for that diagnosis code or not. Is this device visible? Okay, so what it is that it's planted in the upper portion of the buttocks in the fatty tissue. So there's a small incision, either the size of an Oreo or a stick of gum that's on your buttocks, but the device itself, once we implant it and do the permanent device, is not visible. Now, if you have to have a test, then that little device that's on the outside can be worn underneath your clothes where no one else can see it.
Dr. Owens, I think you may have a few additional questions, Q&A that I might have given to your teammate there. I don't know if she has a copy of them for you, but there are a few other commonly asked questions you might be able to address for the participants.
Yes, I'm going to let her tell me those questions. I'm going to say them out loud, and then I'll answer them for the participants.
Sure. Will my insurance cover the device?
So we kind of addressed that earlier. The majority of private pay insurances and Medicare do cover these devices. But like I say, before the procedure's even done, my office does the pre-certification for you so that there won't be any surprises. You will know if it will be covered or not covered.
Do these treatment options apply to both men and women or just women?
So I take care of women, but these treatment options do apply to both men and women.
Can you have the InterStim if you also have a spinal cord stimulator for back pain?
Yes, you can. So that's a great question. So some people have a spinal cord stimulator and their nerve that's being controlled actually is at the upper portion of their spine. And the stimulator is placed in one spot. And then the stimulator that controls the bladder goes from right about your hips to your lower spine. So it's your lumbar and your sacral nerve roots that are being controlled. So yes, you can have them both.
Will it help someone who has a prolapse?
So your urinary symptoms can be controlled with an InterStim if you have overactive bladder or if you have urge incontinence. But if you have stress incontinence that's caused by a prolapse, the InterStim in and of itself will not improve that part of your incontinence. So, but we do that pelvic floor therapy because, like I said, we're urogynecologists and we do that surgery. So we can take care of prolapse surgeries as well.
And the final one is, what is the recovery like after I get the implant?
Okay, so the implant, so if I had to say, if you can see my fingers, the incision is probably just about like that. The suture closes on its own, so you don't have to have any sutures removed. You see me back in the office 2 weeks after. Really, the next day, you just feel like you had a little minor incision. There's not a huge recovery for this at all. You just can't shower until then. I mean, you can't tub bath until the incision is completely closed. Now, if you're doing the test may take 3 days up to 2 weeks to show you any improvement. And with that test, you have to more sponge bath and showers. You can't get the remote and stuff wet. So that is a little bit of a setback for some people, but we have to do that test to make sure that you're a good candidate before we do the permanent stimulator. Okay, I see 2 more questions, I think, unless these are the same questions that I didn't delete. So I answered those already. Okay, so that's all good. Do you
Just a
see any
quick
other questions, Kyle?
No, but I was just thinking as you were addressing those questions, a few other things that I was thinking of. One of the comments you had made during the presentation was about the butterfly vibration sensation that patients may feel. Just wanted to reiterate that that's not something that is a continuous sensation. That's something that becomes a subsensory sensation. So at its normal operating mode throughout the life of the device for the 15 years, you're really not feeling it. It's kind of in the background working behind the scenes. The device is adjustable. You can turn it on or off. You can actually remove it if down the road you feel like it's not something that's appropriate for you, or feel like you'd rather not have this in after so many years. But the therapy's been out for about 25 years, a little over that, and there's several 100,000 patients that have actually received this therapy throughout the life of the device. So it's been out for a while. A lot of people think this is a brand new therapy, but it's actually been out for quite some time. So just wanted to bring that up.
That's great. So one of the most important things that you said is talking about the stimulation and the feeling. So I have plenty of ladies that come in and feel like something's going on with their device because they no longer feel that sensation. But I tell them you don't have to feel that stimulation anymore. As long as your bladder control is where you want it to be, that means that the stimulator is working. So that's a great question. So because there may be some InterStim patients on our as a participant that have questions that hopefully were answered during this Q&A session in this webinar.
And Dr. Owens, can you reiterate just what it is that the patients would come to expect if they were to call the office to set up an appointment?
Certainly, certainly. So you'll just call and say that you're having some bladder issues. You don't have to go into depth, and they will make you an appointment with one of the providers here. And once you get in, then we will actually look and see, make sure that you don't have an infection, because that's the number one thing that we want to rule out. A lot of times people's incontinence is secondary to an infection, and a little antibiotic will treat it, and you'll be done. But once we do that, then we'll just kind of go through your lifestyle. We'll ask you questions. There's actually a questionnaire that we do give out to all of our patients on their annual exam to see if they're actually having issues with their bladder, and if they're wanting any further therapies or modifications. So we'll just kind of go through, get a good history, do a good physical exam, make sure that there's no prolapse, there's nothing else causing your incontinence. See if there's any kind of modifications that we can do. So let's say that I think that there's some dietary modifications that you can do. So we'll do those. I'll bring you back in about a month to see if there's any improvement. If there's not improvement there, then we can go to medications. If you have an improvement from there, then we just watch you periodically on your medications. If there's no improvement with medications, then we can offer the options from there. That would be Botox or the sacral neuromodulator. And we'll just kind of go down that pathway and see what will best fit you to get you back the control of your life that we're looking for.
Well, excellent. Looks like we have maybe one more question, Dr. Owens, just popped up.
Okay.
The individual's asking, how many visits does this take? This person lives 2 hours away.
Right. So I do see that. So it's kind of like what we just talked about. So you'll come in for a visit and we'll go through your history and to see if there's anything that we can do modification wise. And we will make the visits where we can space them out as far as that we need to be able to assist you. So we'll accommodate you as much as we can. But let's say that you come in and we say you need a stimulator, and we can do it all in the hospital. So that will be that you'll come in and we can do your office visit. And then if we can get things pre-started with your insurance, sometimes that day we can also get you on our surgery schedule and do your pre-op visit, and then bring you back for your surgery. And then we bring you back for a post-op. So if you're looking at it to get you started right at first, it's probably anywhere between 3 to 5 visits. But we'll try to, combine those into visits where they're not as many.
Excellent. Well, good. Well, with that being said, if no one has any more questions, I'd like to thank Dr. Owens for taking her time to present this information this evening. It's been a great presentation, and really appreciate everyone taking the time out of their evenings to join us. Dr. Owens' office will make a follow-up to you tomorrow, and look forward to potentially seeing you in the future. Thank you very much, Dr. Owens, for your time. You can sign off.
So
Go
Kyle,
ahead.
I'll just remind them about if any of these problems are your issues, just remember to email us this evening at info@acadiawomenshealth.com, and someone will be back with you tomorrow. Have a good night.